Why are you leaving the Lieutenant Governor's office for this seat?
To run for the United States Senate and to try to put a United States Senator on the side of middle-class Arkansas families and to stand up to the power of special interest groups that are too dominant in Washington right now.
Why take on Blanche Lincoln?
Well, I don't view it as taking on Blanche Lincoln. I'm running for the United States Senate. There are a number of candidates in the race, but I look at this as something I'm running for rather than something I'm running against any one individual.
Where do you stand on card check and the public option?
Sure. I'll take them one at a time, Seth. On what's been referred to as card check, what's happening now in the Senate is that the card check bill, as initially drafted, has been moved away from by the advocates of card check. They have negotiations and discussions on now about crafting a compromise. I have not seen that bill, but I've heard about portions of it. That bill has not yet been released. But there are provisions in there that, as described to me, that I do favor. There's discussions about accelerating the time to the election, where workers can decide whether or not to engage in collective bargaining and to be represented. There's also some provisions, which again have been described loosely to me, that are designed to remove the possibility of undue pressure being brought on workers. I look forward to seeing that bill as it emerges. But my view is that we need, and we have a history in the United States of having the ability for workers to, if they decide in a democratic process, to collectively bargain. I also understand in this piece of legislation that there are some exemptions for small businesses. The exact size of that small business exemption, I've been told, is still to be worked out. But I'd like to see what evolves in the development of this compromise. I know from discussions with others that Senator Pryor has been involved in that process, and I look forward to seeing what emerges from there. On the public option, pardon me. The first thing I note about the public option is it's two words that if you asked 100 Arkansans today, you'd get 100 different impressions about what's actually meant by public option. And I think that unfortunately what's happened is that those two words have been filled in, and what they mean have been filled in by advocates on both sides of the issue. Let me tell you what I support in healthcare reform. The first thing is I would say we need extensive focus on prevention and preventative measures in healthcare. Well-spent preventive dollars can save, a well-spent dollar on prevention can save us multiple dollars down the road. Secondly, with respect to healthcare, my view is that we need to use information technology throughout the healthcare system in a much better and more efficient way. To give you an example, I think every Arkansan has had the experience of going into a doctor's office and on their visit filling out the same paperwork over and over and over again. And I think that folks recognize that in that context, not only are they having to take the time to do it, but they're also they also know that there's a great deal of time spent on the other side of that paperwork by folks who are processing those papers. Third, with respect to healthcare, the United States has led the world in innovative activity, research and development, in technological development and prowess. And we are on the cusp of being able to do something in the healthcare delivery system that takes advantage of that. For example, we now know as a result of technological developments and research developments that it is increasingly less expensive to provide comprehensive testing to individuals that give them an indication of what diseases they might be most likely to have as they age or in different parts of their life. And by using that in a way that takes advantage of that technology while maintaining a respect for the privacy of the individual patient, we can actually go out and alert people early in their lives that they have a predisposition to various diseases, and we can then help them to change lifestyle and behaviors to help them reduce the possibility of them getting those diseases. And finally, you asked specifically about public option, Seth, and let me say this. What I would favor is the development of an option for members of the public to voluntarily buy into a program like Medicare. And I think you'll see that people understand that if it's voluntary, if it's something they can buy their way into, if it's something that where the costs are met, I think you'll see a lot of support for that. And final comment on healthcare. Pre-existing conditions has been something that we have been, as a country, trying to remove the ability of insurance companies to deny patients access to insurance because of pre-existing conditions. We've been working on this for years. It's past time to get that done. And my hope is in these reforms that emerge that we'll see that.